A new primary care clinic opened its doors in Arlington in just a couple days ago, I think it was. It's called Sanitas Medical Center, and I'm joined now by family medicine practitioner Dr. Lucksley Jean. Welcome for being here. This is a 50 and older clinic.
Yes, that's correct.
Explain what is the need for a 50 and older clinic? Why did you decide that that should be the focus of this center?
Well, as you know, the number of Medicare adult is growing. That's all over the state, including Jacksonville. There are actually 4.9 million older adult, which is Medicare eligible. And by 2030, there will be that will make up 21% of the adult population. And by 2060, that number is going to be double from 46 million to 98 million.
So what percent of the population?
4.9 million Medicare eligible. Yes.
I thought you said there was a percentage that it was of the population. Maybe I missed it.
21,
okay.
Yes.
So a significant segment of the population. What kind of special needs do people that are older than 50 have, or what changes when someone turns 50?
As we get older, our body changes. We become more vulnerable to disease. So as a 50-plus clinic, what we do, when we start early for prevention. So we start early, we get to know our patient. We can tailor care directly for this individual. That's what changes.
So I've heard that, it's been that the number of people that are focusing on elder physical services as doctors has diminished somewhat, that it's maybe harder for people to find a primary care doctor that addresses specifically the needs of aging people. Is that a problem?
Yes, it is a problem. There is a not shortage of doctors. I think there's a lot of because of shortage, there's a lot of patients that stay out, don't get the care they needed. It is a big problem.
And so why did you choose the Arlington area for this particular 50 and older facility?
Well, Florida Blue has been in Jacksonville for the last 80 years. This is our headquarters. This is our city. We know the city. We know the needs. We work with local government and organizations that help us that help us find a place which our members can find access easily to come to us.
Yeah, and so is it just because it's centrally located, or is there a particular need in the Arlington area that this is meant to service?
Well, it is because it's centrally located, but in the future we are looking also to expand our clinic. So we're probably going to offer services in different areas.
Okay, and so what sort of response have you gotten? You did just open, was it just last week?
Yes, we opened January 2nd.
Okay, and so what sort of reception have you gotten? What kind of response have you heard from the community?
So far, so good. We the patient that we've seen, they're giving us feedback and they're enjoying the center. They love the center. The services we offer, we probably are among the very few that offer those services that we offer.
Do you plan to open additional facilities, additional offices that would serve a 50 and older community?
Yes, that's our plan. We plan to expand. We currently have about 50 clinics across the state, and we plan to open about 8 more this year, and there's more coming up in 2025.
Any particular locations that you're going to be looking at in the Northeast Florida First Coast region?
We do not have any particular location now. We have the research. We're looking at different places where we're going to expand.
But you believe that that need exists?
Yes.
So how can people connect with the clinic? Do you have to be a Florida Blue patient in order to go? And how can people get more information?
This is exclusively to Florida Blue members of 50 and over, and Florida Blue Medicare patient of all ages. I could give them the number to the clinic if they want to connect with us.
And it's Sanitas. What does that mean? What is the meaning behind the name?
Sanitas. From the Latin word sanitas, which means health. But it's more than just the name. It's a brand, what we do for our patient, how we connect with our patient. That's what it means.
And so have you personally had, stories to tell patients that you've dealt with in your role as a physician that have, has made it clear to you of the need for people to receive, specialized health care when they get older?
No, not at the moment.
No.
No.
Okay. And are you personally involved in that clinic? Are you is that a
I
facility that you're
am
at?
personally involved in that clinic. I am the medical director of the clinic. So I've seen the everyday operation of the clinic. Yes.
And you're still seeing patients though.
Yes, definitely.
And so, what do you hear from them about the need for this kind of care?
No, they enjoy. They enjoy the need for that care. Care. We offer more than just the primary care. We have, for example, we have on-site dispensing medication. We do our lab. We have imaging. We have ultrasound, X-ray. We have mental health. We have pain support for patients who have pain. We have a massage therapist that does that. We also offer services like yoga, Zumba, all of this into one center.
Well, Dr. Lucksley Jean, thank you so much for joining us today.